Well, hello everybody. This is Dr. Jerry Cuomo. I'm here with the All-on-4 case. Again, I wanted to give you a little more of an insight as to how to fit check these cases once they come back from the laboratory technician's office. Um, so what I've done is I've asked my surgeon to give me an analog. This is an abutment replica for the multi-unit abutment, and normally they are placed in a model like this. I just put that in focus. Um, there we go. So sometimes it's impossible to fit check once you have the model back and you've got all this gum tissue on it. You can peel that off and certainly try to fit check it, but the only real way to do it is to just take a single abutment analog and then go ahead and start to see if everything fits. Now, what I've done from the last video is I pointed out that there was some sealer or some acrylic that was caught on the rim, and so I wanted to remove that material. So I took a brand new 15 Bard Parker scalpel blade and went ahead and hand trimmed that gently without hurting the metal. Now, the way to do that is you've got to put the non-cutting edge of the Bard Parker blade. There's the cutting edge and the non-cutting edge. Let me just lower the mag. Okay, so here's your 15 blade non-cutting edge. I slide that on the metal and I just literally just scrape in this fashion and remove excess. So let's blow that up, take a look at that more closely. So you're getting really close up now, and it's such a good feeling that you know you're going to be in control here. You got the ability to fit check this case. So I went around and I just cleaned up, leaving the non-cutting edge against the metal so you don't destroy the metal at all, and then allow that blade. It's got a nice roundness to it, and as these blades dull, you can just take a new one and just use that. All right. So again, I'm getting rid of the flash. I did a good job on this one. I did a really good job on this one here. But there's one more that I had difficulty with, so I'm really going to have to work on that one during my break. So here's the analog. You're going to push it up against it and make sure there's no daylight whatsoever. You can also take a screw and send it down through the screw access hole and go ahead and simulate the tie-in. Alright, and just to make sure that there's no acrylic between metal and metal, so it bottoms out all the way. Now we'll check the next one. Again, do the same thing and just try to make sure that you don't have any daylight whatsoever. So look all the way around it. Okay. Very important to do that. Alright, now here's the bad one. Alright, so this one I really got to work on. Look how much daylight in there. That's way too much. That'll never seat in the mouth. And you've got one of these up, and guess what? You put pressure on all of the other screws, and eventually what you'll have is bacteria invasion, problems, etc. So again, take a single analog, go in there, make sure it bottoms out all the way. Same here, and of course I've got my work cut out for me on this one, so I've got to clean that one up. So how would I approach this one? Similar to the others, I take a fresh Bard Parker number 15 blade and I just start to hone it like that. Just start working on one end, pushing it against the acrylic. Just keep pushing it against the acrylic, and you start to see I'm clearing a path, but I'm not gouging the metal. And just dry that off. And see how that's nicely coming out. I'm not really hurting the metal at all. I'm keeping the non-cutting side against the metal, and I'm just literally using. Now you might ask the question, well, couldn't the lab take care of that for you? You know, it seems like it's a tough spot. I would say, yeah, I think this is definitely a laboratory procedure. We're in a situation where we've got a patient coming in. I've decided to take charge. I use a microscope. I mean, your lab should have a microscope to use, and it's important, you know, to get them to use scopes and to fit check these things before you get them. You know, there's a lot of work that went into this, and a lot of it went into the building of the case. And here you are, ready to go with your final seating, and this is one aspect of the whole picture, the whole design of the case that's so important to recognize. And so with this video, I hope it really does hit home with a lot of you out there that are doing these all-on-4 cases, and make sure that you double check that last and final step before it goes in. So upcoming video is to put this case in. We'll give you plenty of footage on that. I appreciate your tuning in, and Dr. Cuomo on an all-on-4 case, fit checking, making sure everything is going to fit perfectly. All right, take care. Hope you enjoyed it.